Hello, I'm Anna Ricklin, and I manage APA's Planning and Community Health Research Center in Washington, D.C. Joining me today is Rodney Harrell from AARP, co-author of What is Livable? Community Preferences of Older Adults. Rodney, what is aging in place?
Aging in place is the concept that older adults want to stay in their homes and communities for as long as they can. We found in this report that most older adults want to age in their homes and communities. And of course, that preference gets stronger as you get older. You've built a lot of social connections, you're familiar with your neighborhood, you like your home. The question is whether your home and community enable you to age well there.
So why is it important for planners to think about this topic? What can planners do?
I think the biggest lesson of the work that we've done here is that older adults need to be incorporated into the work of planners and policymakers at the local level. That older adults are in the community, they're growing in large numbers. The older adult population is going to grow strongly as the baby boomers age. And so we need to make sure that our homes and communities enable them to work.
And what challenges do you see facing communities as our populations age?
There's several challenges. There are challenges really, I think, formed by the fact that we're a suburban society for the most part. And so we've built a lot of communities around the car. And so that means that once you can no longer drive, you might be stuck. And so suburban isolation is a big concern, that you can no longer walk to the grocery store or parks or pharmacies or any of the things that older adults want to be near. And so if you're without those things, and if you're having trouble meeting your friends, relatives, your social network is falling apart because you can't get to the things you need to. So what that means is we need to enable older adults and everybody to get around their communities. So that's options for transportation and designing communities where people can get around and interact. At the same time, we need to make sure that the designs we have allow people to move about safely. So things like sidewalks that are trip hazards or getting rid of those and making homes that are universally designed so that people can get around and in and out of their homes safely. So those are things that help older adults, but they also help all of us as well.
Would you say that people who are aging in a more urban environment have an advantage or are in a better situation for getting older than people who are living in suburbs or rural areas?
Sometimes, but not always. I think one of the things we learned in this research is that people are amazingly adaptable, that people adapt to all circumstances. And so there are some that have figured out the ways to make their home and community work for them no matter where they are. So I don't expect us to see a sudden rush for everyone to move to the cities. However, many urban areas have a lot of the advantages that we're talking about already. They have the compact design, they're walkable, there's a range of housing options to meet your needs already there. So for a lot of people, those options might be the best.
So this report, what are some of the main key findings that you found through your research?
This was some very interesting research for me. We found two things in the big picture. One is that the needs of older adults and needs and preferences of older adults overlap with the needs of younger families as well. So older adults wanted to have police presence, they wanted safe neighborhoods, they wanted good schools were high in the ranking order, proximity to things in neighborhoods that worked for them. Those are all things that people of all ages would prefer. At the same time, we noticed that older adults aren't one monolithic group, that there's many kinds of older adults just like there's many kinds of people. And so they have different needs. So if you're someone who's caregiving or has a disability, then you're going to be more attuned to the needs to have safety or perhaps transportation options for not driving. If you're a renter or somebody with low income, you're more attuned to the fact that you need affordable housing in your community. If you are a person of color, you may have different preferences for the types of things you want in your neighborhood. One of the interesting findings was that for African Americans, the majority of them meet and interact at church. That was a key thing for them to have in their neighborhoods. But if we looked at whites, for example, most of them met at private establishments, taverns and diners and restaurants, shopping malls, etc. So if you're trying to create a neighborhood that meets folks' needs, you really need to understand the type of people that are going to be there and making sure those needs are met. So at the same time, older adults are not as foreign as we might think. There are certain needs that the older adult population has more than younger groups, but the older population is so diverse that meeting the needs of older adults means that we can meet the needs of all people in the community.
I've been thinking about that as more and more people are aging, and so in a sense the older population is actually becoming more and more ethnically diverse, different backgrounds, and that they will want to age in different ways. Is there any way that people who are planning for that population can communicate better with the older adult population?
I think that's a crucial thing for planners to do. We need to be able to reach out and understand the needs of the people that we're planning for. And I think what happens as I go around the country and talk to a lot of planners, I hear two things. One is that folks already have such an older population that they know what people need and they're scrambling to figure out how to meet it. And two are the planners that don't necessarily have a large older population yet, but are starting to think about what to do, but aren't quite sure how to do it. And the first step is to talk to the community, understand what their needs are. But the second, and I think this is one of the big lessons from this research, is to not completely separate older adults from the rest of the population. That when you start to incorporate some of these principles of making communities safe and making access easy, making things affordable, those are things that older adults benefit from. But again, they benefit people of all ages. And so if we start to create communities that meet all of these needs, we can really encompass all of the people in communities.
And we can plan for everyone to be aging in place.
Absolutely. I mean, in the ideal world, everyone would be able to stay wherever they wanted as long as they could, right? That if you've picked a home and community that works for you, you should be able to stay there. Now, the choices we have now are not necessarily the ideal ones. That people may have only had the one choice of a home that wasn't accessible by public transit or some of these other features because that was all that was in their community. But in the future, we can perhaps create communities that have more choices so that people can get what they need.
So, Rodney, where can people find more resources about how to learn to plan for older adults and find this report?
So we have a great resource online. It's the AARP Livable Communities website at aarp.org/livable. From there, you can click on the Public Policy Institute and you can see all of our research, reports, and analysis on planning for older adults and planning for people of all ages. Now, this report actually launches our Livability Index project. So over the next year, we're planning to develop an index to measure community livability using some of the lessons we have here. And so we've got this report, we've got a companion report, some other pieces on the Livability Index project. And so you can find that online as well.
And do you have some policy guides for planners to use in their work, or is it something that they can tailor for their own needs?
We have some model legislation for various issues for manufactured housing, for accessory dwelling units. Some of those other issues are online. But what we really have are a range of resources about particular issues affecting communities. And so hopefully what a planner can do is go online, find these resources about an issue that they're curious about, and then go and apply that in their communities.
Great. Well, thank you, Rodney Harrell from AARP, for joining us. And I would also like to say that APA is releasing a report very soon on aging in community as well, a policy guide for aging in community. So we also have some resources available for our members.